Well, Dr. Samuel, we have talked a little bit about missing teeth and the consequences of it, which it's quite a few of them, including perhaps headache, muscle tensions, and all kinds of stuff. Never mind the not looking so good, never mind the chewing, and never mind the fact that one will probably lose many other teeth because of one tooth missing. So what are some of the major ways of replacing them, and what has changed over the last, let's say, 10, 20 years of what can be done in replacing those teeth?
Okay, well, if we're just talking about one or two teeth in a row, there are basically three ways to replace those teeth. And the first way, which is something that's been done for 100 years, is something called a removable partial denture or a plate. It happens to be the least costly. It's probably the least desirable, but it is something that can be done fairly quickly, and it's something that you take in and out of your mouth. Obviously, it's not as desirable as something that is permanent or fixed in the mouth, but it does serve a purpose. The next thing is something called a bridge. A bridge is also something that's been done in dentistry for 100 years, and that's if we have a tooth or two missing in a row, we have to put crowns on the adjacent teeth and then have false teeth connected to those crowns. It's called a bridge, a 3 or 4 unit bridge. The problem with that is that we have to grind down the adjacent teeth to hold this appliance in place. When it's done, it'll look good, it'll feel good, and it will last. The average in the industry is about 10 years, maybe 10 to 15 years. But the problem with it is we've cut down a couple of teeth that might have been in perfect shape, and now we've weakened them. So 10 or 15 years down the road, they may have problems. They could possibly end up being lost. So we try to avoid bridges today. And the best thing, and this is what's come about, although we've been doing them for 30 years, it's only the last 10 years that it's become more routine, and that's something called implants. Implants are the greatest thing to hit dentistry. If we have a tooth or two missing, we don't have to touch any of the teeth in the area. It's a very simple procedure to simply insert one of these titanium screws into the gum. I know it sounds horrible, but it's a really very simple procedure. And then a tooth is screwed into that. It doesn't happen in one visit. It takes about 3 months to do. But once an implant is in place, it will probably last the rest of the patient's life. So even though it's pretty incredible how long it can last. And yes, it is more expensive, but in the long run, it's a lot less expensive in terms of first cost, and also because it saves your teeth. It doesn't touch anything else.
Well, it makes sense that it's less expensive on the long run, because if you after 10, 15 years, give or take, and I'm sure some of them might last, crowns and bridges, might last longer than that, some a little less, but if you have to replace them, the cost must exceed the one time of an implant, with no doubt, especially if there was only one tooth missing, where, if you do a 3-unit bridge, you have to grind down 2 teeth, you have to make 2 crowns, you have to make a crown in between, which is 3 crowns, 3 porcelain crowns. They cost money, whereas when you do an implant, you only have one. I don't know how much the price difference there is, but if you have to redo that 5, 10, 15 years later, you've got to exceed in price there.
Oh, absolutely. Yeah, 3 in a bridge and a single tooth implant are fairly close in price to even begin with. Right. So, yeah, if you do have to replace a bridge 10 years down the road, now you're behind the 8 ball in terms of costs.
Right. And now let me ask you, I've heard that, so when you have one of the reason a bridge fails, one of the reason only, I'm sure there's, you said one already, which is that if you hang the whole bridge on it, becomes weak because you had to grind it down, and it might fail, and then you have to have a bigger bridge and whatever it may be. But another one is, it seems to be more difficult to do dental hygiene in that area where there's a bridge, because the teeth are welded together. You can't go in between. Your flossing becomes more difficult, not impossible, but more difficult. And I have a lazy guy like me who is washing, showering, shaving, brushing teeth, and my wife is still, I think, on her first or second tooth. So a guy like me, I probably would have a failed bridge in no time, because I probably would not floss when I should, at least not as often. And then I would say, once a week is good enough. And is it true that that would then actually be part of causing the bridge to fail and have gum disease?
Oh, absolutely. It is more difficult to keep clean, that's for sure. While a single tooth implant, you can floss as if were just regular teeth. So, yes, you're right. If you have to use a threader to go underneath the bridge, it's going to take a little longer, and some people may not do it, so that can lead to failure as well. Certainly, a single tooth implant is easier to take care of.
Mm-hmm. And of course, in other videos, you mentioned the enormous danger of having a gum disease. Never mind the failing of the tooth, never mind the failing of the bridge or the losing the tooth, which at least it can be replaced. Technology is good today. But while you have it, you have gum disease going on. And as I said, you mentioned that much more heavy in some other videos. So, all right, well, here you have it. The technology evolved. We have partial removables, we have crowns, bridges and crowns, and we have implants. An implant is kind of like the new thing. I mean, we want the newest car, we want the newest DVD, we want the newest cell phone. Why wouldn't we want the newest technology of fixing our teeth, right?
I totally agree.
Well, all right. Thanks a lot. Very informative, Dr. Samuels. Very informative.
Thank you.